Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Fahmi Ilyas. My study number is 085. And now I will explain about Angelman syndrome. What's Angelman syndrome? Angelman syndrome is a genetic disorder that affects the nervous system. This condition will cause developmental disorder, including movement, balance, and speech. Angelman syndrome is a rare condition. This condition is estimated to only occur in 1 in 12, 12,000 people. Cause of Angelman syndrome. Angelman syndrome is a genetic disorder that can sometimes be passed on by a father or mother. This condition occurs when the UBE3A gene is not formed, is formed but is not perfect, damaged, or not functioning properly. The UBE3A gene is on the 15th chromosome. Normally, children inherit this pair of genes from their father and mother. This active gene pair plays many roles in the body, including the several parts of the brain. When there is a disorder or abnormality in this gene, developmental disorder will begin to appear when the child is 6 until 12 months old. It is not yet known the exact cause of this gene disorder or mutation. However, having a father, mother, or family member who has Angelman syndrome increases the risk of developing the same condition in the child. Signs and symptoms of Angelman syndrome. Some of the common signs and symptoms that may appear are microcephalus or smaller head size, seizures, ataxia, or impaired balance and coordination. Speech disorder include inability to speak. The arm is easy to shake or move without releasing it. Likes to stick out his tongue. The limbs are stiffer than usual. Crossed eyes or strabismus. Skin looks pale. Hair and eyes are lighter in color. Scoliosis. Eating disorders, including difficulty chewing and swallowing food. Children who have Angelman syndrome also have a cheerful attitude, are easy and smile or laugh aloud, are hyperactive, and are easily distracted. Some children can experience sleep disturbance. The child's attitude, who tends to be more cheerful, will decrease with age. When to see a doctor. Take your child to see a doctor if he or she has the above mentioned Angelman syndrome's symptoms. especially if the child has developmental delays. A doctor examination needs to be done to find out the cause and so that children get treatment from an early age. If the child has been diagnosed with Angelman syndrome, control it according to the schedule given by the doctor. Routine control is needed so that the child's condition is monitored. Angelman syndrome diagnosis. To diagnose Angelman syndrome, the doctor will ask the parents about the complaints experienced the child. Oh, I'm sorry. About the complaints experienced the child, medical history, and family medical history. After that, the doctor will perform a thorough examination, including examination to assess the child's growth and development. To confirm the diagnosis, the doctor will perform genetic tests to identify abnormalities on the chromosomes. Genetic tests that can be done include DNA tests of the parents or DNA methylation to look for genes that are not normal. Fluorescence in situ hybridization or FISH tests to check for missing 15th chromosome. UBE3A count mutation analysis tests. Medicines. One method to treatment that can be done is direct administration. Medicine will be given according to the symptoms that arise. For people with Angelman syndrome who have seizures, the doctor can prescribe anti-seizure drugs such as vaporic acid and clonazepam. Therapy. Several therapy that can be done are communication therapy, behavioral therapy, physiotherapy, and activity therapy. Angelman syndrome complication. If not treatment promptly, Angelman syndromes can cause complications such as eating disorders, sleep disturbance, hyperactive scoliosis, and obesity. Angelman syndrome prevention. Angelman syndrome prevention. Angelman syndrome is a genetic disorder that is difficult to prevent. If your child has symptoms of Angelman syndrome, check with the doctor to get treatment early so that the child can adapt to the disorder he is experiencing. In addition, for those of you who are planning a pregnancy and have a family history of Angelman syndromes, it doesn't hurt to do genetic testing or screening to determine the risk of developing Angelman syndrome in your child. Thank you for your apologize.